And Lloyd, thank you very much. Thanks to all of you for joining us this afternoon. Thanks once again to the Bay Area Council for partnering with the Committee for Economic Development. It is always a pleasure for us to be in this great city, and particularly in this great room with the wonderful views. But we also have a lot of work to do in healthcare reform. And my message this morning will be very brief, and it's very simple. It's not over yet. I know there's a very prominent local politician here who gets a lot of credit for getting a bill through the House. Some people like it, some people don't. The Committee for Economic Development, we would have rather have seen the Wyden-Bennett approach in the Senate, and we do have some problems with what is in the House bill. But what I will say to you, I really don't think the debate is over yet. The bill passed the House. The Senate is still a work in progress, and as early as this morning I got a note from Ron Wyden, a Democratic senator from Oregon, basically saying he's not giving up the game. And if you read the front page of the New York Times this morning, the story on the lower left-hand part of the paper indicated that the bills that are working their way through both the House and the Senate really don't do very much in the way of cost containment. And when President Obama held his White House summit earlier this spring, and I was very privileged to be there, I was very pleased that the first words out of the president's mouth were not about universal coverage, which we support, were not about IT reform, which we support, were not about cost and not about competition. They were about cost containment, bending the cost curve, getting the cost down. And quite frankly, the legislation in Washington doesn't do that yet. And if we impose the types of reform that are now being contemplated in both chambers on top of an unreformed fee-for-service system, it may be an exaggeration to some, but I genuinely believe that we will bankrupt the country because we will not be able to pay for it. On the flight out yesterday from Washington, some of you know I'm in love with the Kindle. I know very little about high technology, but I'm in love with the Kindle, which lets you take 1,500 books with you anywhere you go. One of the books I carried, downloaded over the weekend, was by T.R. Reid, who's a columnist for the Washington Post. I urge that you take a look at his book because it's all about healthcare delivery in other countries, in France, in Germany, in Japan. They manage to spend 50% less than we do and get better results. Their citizens live longer. They have a better outcome in terms of infant mortality. They do not have the obesity and diabetes epidemics that we have. It's an eye-opening look at how other countries approach the same problem. CED started this work 2 years ago this month with Alan Enthoven, actually 3 years ago. The policy statement came out 2 years ago. Dr. Alan Enthoven, who you'll hear from shortly, was the project director. And we called for incentive-based, market-oriented reforms. And it turned out that a lot of what CED has been recommending was also being worked up in legislation by Senators Ron Wyden, Democrat from Oregon, and Bob Bennett, a conservative Republican from Utah. Wyden is not going to give up. CED is not going to give up. There is a split in the business community, quite frankly, between groups like CED, which want to change the employer-sponsored system because we think it's unsustainable, and the Business Roundtable, which wants to keep the employer-sponsored system because they think it's a good way to compete for talent. Quite frankly, I'd be embarrassed to make that position publicly, and have gotten a little bit bolder, Lenny, in recent months in talking about that. So we do think there is a business case for national health care reform. We hope that you will be part of it. We hope that you will, between now and Thanksgiving or Christmas or New Year's, when legislation does get to the President, that your voices will be heard and that we have an opportunity really to do some good in this country, to help all Americans, but to do it in a system that we can actually afford. So I thank you very much for coming. I now want to introduce our first speaker, who is a CED trustee. Rob Chess is also a friend of almost 20 years. We first met when Rob was a White House fellow in the first Bush administration, the H.W. Bush administration, and we got to conspire a little bit back then, Rob, on an immigration reform bill, and we've stayed in touch ever since. And Rob came back to California, started up, and is now the chairman of Nectar Therapeutics. In addition to being a CED trustee, he is the co-chairman of our healthcare subcommittee, knows this area very deeply. And Rob, I want to thank you for your friendship and your lifelong commitment to public policy issues, for having the courage to do something about it, and we're very honored and privileged to have you as a CED trustee. Please welcome Rob Chess.